Very good. So welcome everybody to Revivery and our 24-hour virtual fast. And I'd like to introduce Dr. Shyrlena Bogard, who can take it away. And Dr. Bogard, would be great is if you don't mind, maybe just 10, 20 seconds on your background. Some people did not come to the intro yesterday, so that would be great as just an intro.
Okay, real quick though, can you tell me, does the screen look, can you see just my screen with the slides?
Yes, we can.
Okay, so hello everyone and welcome. As Josh said, I'm Dr. Shyrlena Bogard, and I'm actually an OBGYN by training, but over the course of my career in treating women, I recognize there's a huge void in managing hormones. It's something that we as physicians kind of missed the boat on. And so it's something that I got a passion for. And in my own life of bodybuilding, I really recognized there was a huge void. And so over the course of the years, I've just gotten lots and lots of education, and I've learned to kind of incorporate that into how I treat patients. And it's really changed how I treat patients, and it's really helped a lot of my patients. And so today we're going to talk about your hormones and just how vital it is to make sure your hormones are managed and optimized, not just for, people talk about bodybuilding and sexual health, but for disease processes and your health overall. So.
And one other quick interjection. Dr. Bogard is going to take us through this. It'll be about 40 minutes or so, 45 minutes, and then we'll open up for like 10, 15 minutes of questions. That's the goal. Thanks.
Right. So optimizing your hormones for lifetime of vitality and wellness. So I don't know if anyone's ever grabbed a magazine when you're on a flight. If you have, there's usually this guy right here is in the back of the magazine. This is Dr. Jeffrey Life. He is, I believe, a cardiologist who around age 55 noticed that he was gaining lots of weight. He was working out, but still gaining weight, feeling very sluggish. And so just trying to figure out what was going on. Well, one day he was at the gym talking to one of his friends about, man, I'm eating healthy, working out, but still feeling sluggish. Yet his friend, who was about the same age, was looking good. And he's like, what are you doing? And his friend told him about hormone replacement therapy. And to make a long story short, Dr. Jeffrey Life, after learning about hormone replacement, got on testosterone, and he actually entered the Body for Life contest, if anybody remembers that. And a few months later, this was him. So, but this goes to show the importance and how once you manage your hormones, how you can have the same diet, exercise regimen, but having that foundation is so important. And so one of the things I want to make sure as we do this talk is that you really recognize and understand the difference between being normal and being optimal. So many times when you go to your doctor, we're always focused on, normal. So a lot of times when you go, if you look here on the left, you'll get a report of your labs, and it looks just like this. You'll see the labs that were drawn. You'll have your result, and then you'll have this reference range. And then if you're within that reference range, your doctor says you're normal. Well, those normal ranges are determined using a subset of the population who's usually in their 40s, 50s, 60s, and not necessarily healthy. And so to put it in picture, this is what normal lab values look like. And I don't know about you, but that's not my goal. This is what optimal lab values look like. So if we were to take, let's just say testosterone, if we were to take a 20-year-old female and look at her testosterone levels, she'd probably be around somewhere between 100 and 200. However, a 35 to 50, 60-year-old woman, it begins to decline, and hers is only somewhere around 30. And so her doctor's going to say, well, that's completely normal. Well, she is going to feel that difference. And it's very, very crucial to recognize the difference between being normal and being optimal. So let's just dive right in and talk about testosterone. I would say out of all of the hormones that we try to address, testosterone is one of the most important ones. Testosterone is important in everything from your head to your toe. It actually helps with decreasing your risk of all Alzheimer's. It decreases your risk of all cancers. It decreases cardiovascular disease. And so it's utilized in making muscle. It decreases male prostate cancer. It actually, for women, it can be utilized to create estrogen. And so sometimes in patients who, let's say if you've had some type of estrogen positive cancer and you can't take estrogen, you can take testosterone and you can get enough conversion of your testosterone to estrogen to actually combat some of the symptoms of being estrogen depleted. And so testosterone is really a powerhouse, and it's also utilized in your body making its growth hormone. And growth hormone is so important in your body's ability to repair itself. And so when we're sleeping at night is when our body's making growth hormone. If your testosterone is deficient, your body's not going to do that very well. And that's when you're waking up and you're having the muscle aches and you don't recover as well. And so just by addressing your testosterone level, you really can optimize some of these functions that your body does. So what are the benefits of testosterone? You will see here, there are many. It helps in your red blood cell formation, helps with energy levels. It definitely helps with your lean muscle to fat ratios, decreases body aches, increases heart health. It is the #1 factor that you can control to improve your cardiovascular health, increases bone strength, lean body mass, increases muscle strength, mental focus, verbal memory, spatial abilities, improve mathematical abilities. And so, like I said, everything from head to toe, testosterone does affect. So once your testosterone is optimized, you really feel like you can take over the world. Now, so for most men, around the age of 25 to 30, your testosterone level will start to go down about 1% every year. And so for men, that testosterone decline is very, very slow. Most men actually don't really recognize these symptoms because the decline is so slow. And usually sometimes around the age of 45 or 50, they will start to notice that either they start to put weight in their midsection, or they don't wake up with their morning erections like they normally do, or they have difficulty maintaining erections. And that's typically what brings men in. But because that decline is so slow, they don't typically recognize it. But there's a decline of about 1% per year starting at the age of 30. And for women, on the other hand, that decline is much more steep. And so that's why women, when we're about age 40, between 35 and 40, we start to just quickly decline and crash and burn, because our ovaries just really, really crash. And as you can see, that decline is much more steep. And so we feel things and we will tend to present to the doctor much quicker. So things that you will recognize if your testosterone is deficient. Most people will complain of increased fatigue. You don't sleep as well, decreased motivation to do things. You have a decreased sense of overall well-being, decreased mood, muscle weakness. Your body's not repairing itself efficiently. And so you tend to feel weaker, increased body fat, usually in the midsection. And that has to do with the testosterone and estrogen ratio, because as that testosterone goes down, the estrogen is going up, and it's going to put all that fat in your midsection. You'll begin to notice some rapid hair loss, increased breast size in men. That's another thing men will notice as they begin to have female-like breasts, because they're going to have more effects of estrogen than they are from testosterone. And then also they will notice the decrease in libido and orgasmic function. And so the problem with this is patients will present to their doctor complaining of these myriad of symptoms, and a lot of times will get diagnosed with something else. They will be told they're depressed and get put on an antidepressant. Will be told, that they, have cardiovascular disease, when no, we just need to address these hormones. And so patients have these vague symptoms and they get medical mismanagement, And so you have a twofold thing here. Now you're taking a medication that you don't necessarily need, and you're also continuing to go with hormone deficiencies and the medical problems that can occur from that. So I often get the question, do women really need testosterone? So many women are afraid that if they take testosterone, they're going to end up looking like this. And they like, I don't want to look like a man. You know, am I going to grow a penis? I can tell you, this person on the right, she took more than testosterone, and you have to purposely work to look like that. A woman who takes testosterone to just get it at normal levels will actually look more like this. So she will begin to sleep better, her mood will be better, her mental thinking will be better, her sex drive will be better. She will actually begin to be able to lose weight, and so her fat to muscle ratio will be better, and just overall well-being is improved. And so typically women who have testosterone deficiency, once they improve that, they actually feel a lot better. And I can tell you time and time again, I've had patients who've come to me, were very reluctant to get on testosterone, and a year later, it's the one thing they will not allow me to take away. They're like, just don't take the testosterone away, because of how much it improved their lives. And so it's absolutely crucial for women to be on testosterone. And if nothing else, this is one of the really critical reasons why women should be on testosterone. 1 in 3 women in the world dies of a cardiovascular disease. So every year, 7.6 million women die from cardiovascular disease. The problem is, as physicians, we are taught to keep women on estrogen for the smallest amount, for the shortest amount of time. We do not give women testosterone. When you take a woman's estrogen and her testosterone away, her cardiovascular disease goes up tremendously. 3 years after a woman goes through menopause, if you look at her cardiovascular, her blood vessels, she has a marked amount of stiffness in the blood vessels. And so by maintaining her estrogen and her testosterone levels, we actually significantly decrease the cardiovascular disease. Yet we're taught to take women off of estrogen and not even give them testosterone. And so to me, that's just a travesty that we've got 1 in 3 women dying from cardiovascular disease. We have a treatment that works, yet we don't want to give it. So what can you do to maintain your testosterone levels? Again, a lot of people are reluctant to go on hormones, and we know, what can I do without going on hormones? So foods you can eat, things that are high in vitamin D content: garlic, tuna, egg yolks, fish, liver is really good. It's not good, but it's really good. It has a lot of vitamin D content. Broccoli and nuts. Herbs, ashwagandha, if you look at some of the pre-workouts, a lot of them will have these ingredients that you see here on them: the ginseng, ashwagandha, yohimbe, saw palmetto, because those things actually help your body to increase its production of testosterone. Fenugreek's a really good one. A lot of women who are going through menopause, who want to take natural products, will use fenugreek. But any of these herbs will actually help your body to make testosterone naturally. Vitamin supplements that you can take. DHEA it's in the cascade that actually helps your body, the testosterone that you have, it helps the testosterone to stay testosterone so that it's not converted to estrogen or DHT. And then zinc and chrysin is also helps keep your testosterone from becoming estrogen. So any of these supplements will actually help you to naturally maintain your own testosterone levels. And lifestyle, this is probably the one thing that you truly have control over. Every now and then I'll see a male patient who's 55, 60 years old. He's not on anything, test his labs, and his testosterone level is 500, 600, 700. And when you talking to him, we'll see that he has a lifestyle that has low stress. He exercises regularly. He has a healthy diet, doesn't drink, doesn't smoke, but lifestyle is so important. So the more you manage your lifestyle, the more your body is able to make testosterone. When you have a high stress life, you tend to have higher cortisol levels. And we're going to get to cortisol after this. Cortisol actually, it blocks your body's ability to make testosterone. And so when you have high stress all the time, you're stressing your adrenals out, your cortisol is up, you're not making testosterone. And then you get all the other stuff we talked about. So just by managing your stress, getting adequate sleep, I don't know if Dr. Anthony talked about it in his talk earlier, but in the Big Reviver, we talk about sleep cycles. And so you want to try to get sleep cycles of about 90 minutes. If you count those out. Regular exercise, lifting weights is very, very important. And so your lean muscle mass actually helps to maintain your testosterone levels. And so cardio is fine, but really that lifting weight and maintaining your lean muscle mass is going to be very beneficial. Getting some sun, because again, sun is going to help you to maintain your vitamin D levels. Avoiding estrogenic compounds. And we're going to talk about that when we get to estrogen. But so many of the things that we are exposed to create XENOESTROGENs, phytoestrogens, which are the bad estrogens. And so those things are going to fight your testosterone levels. And then a healthy sex life. Orgasms actually increase your testosterone level. There are studies to prove that. And then if you are insufficient, so if you truly have a testosterone deficiency, you can use these other things, but most likely they are not going to get you to normal physiological levels, and you are going to need some type of prescription supplementation. And you can take that orally, you can use topical creams and gels, injectables, pellets. They all work fine. And, you know, patients will often ask, well, which is best? I always say whichever one is going to work best for you in your lifestyle. If you travel a lot, pellets are probably the best for you, because it's really difficult to travel with injectables and gels and creams. If you're someone who's home every day and you don't mind taking a pill, pills work for you. So it's just your lifestyle and what works for you. But the main thing is that you take it. One thing about pellets, because people do ask, pellets are injected. This guy's down here on the lower right, those are pellets. They're injected either into your flanks or into your buttock area. For men, they last 4 to 6 months. And for women, they last about 4 months. So you come in about every 4 months and get them injected, and they work really, really well. So moving on to estrogen, let me look at my timer here. Functions of estrogen. So estrogen is important for both men and women. And it's one of the main things it's good for is for maintaining bone health in both men and women. It helps with our brain health, decreases our risk of Alzheimer's disease. We know in women it's for our uterine health, for preparing the baby, the uterus for babies. It's good for cardiovascular health, as we talked about earlier. So we have 3 types of estrogen. The healthy estrogen, the one that we focus on, is estradiol. Now, estrone is the bad estrogen. That's the predominant estrogen in older postmenopausal women. And then estriol is the predominant estrogen for pregnancy. But estradiol is the healthy estrogen, and that's the one that we want to focus on. So if you look here, like we talked about, so the blue is the male, and you see how that male testosterone level slowly declines. And then if you look at the red, the female and her estrogen, you see right at around 40, that estrogen level just dramatically declines and drops. And that's when women start to experience all these things when they come in complaining of, I can't sleep, I'm gaining weight, no matter what I do, the weight's packing on my midsection, my memory starting to go, you know, my libido is gone, and the vaginal dryness, all those things just suddenly start hitting her all at once, because that estrogen drops so dramatically, so quickly, as does her testosterone. And so these are the things that you can experience with estrogen. These are real medical problems that you are at risk for with inadequate estrogen. Cardiovascular disease, as we said, stroke, diabetes, Alzheimer's and dementia, osteoporosis, and decreased sexual function. So estrogen dominance. one of the things that people misunderstand is that when you start going through menopause, and so your estrogen level is low because your ovaries are making less estrogen. However, the rate of production of the other hormones, testosterone and progesterone, is 7 times lower than estrogen. So although your estrogen is low, your body is predominantly only seeing estrogen because it's not seeing a balance of the other hormones. And so then you start to notice these things where you get depression, water retention, weight gain, and headaches, and things like that. So, and I kind of mentioned a little bit about the xenoestrogens. And so this is like when you hear people saying, you know, in the plastics and the shampoos and things that we use, what xenoestrogens do. So they are the byproducts. They go, if you have your cell, we have these little receptors on the cells. So they will fit into the estrogen receptors, but what they do is they downregulate the action of the cell so that it cannot function as it should normally. And so you end up getting all of the bad effects of the cell instead of it doing what it should do normally. And then they stick to the cell a lot more stickier than normal estrogen does. And so that's what those xenoestrogens that you hear people talking about a lot. And this is the cycle that women and men get in with estrogen when you're estrogen dominant. Our body can take our fat to make estrogen. Estrogen increases the body's storage of fat. The more fat you have, the more estrogen your body makes. The more estrogen you have, the more fat your body stores. And it's this cycle that is very, very difficult to get out of. And so this is what it looks like when a woman comes to the doctor and she's got problems with her estrogen. All this stuff going on, and then you really start to feel like you're going crazy, and you feel like I'm just complaining, and and you just feel like it's like you really don't even want to say all these things that are going on, but it's real. It's real. And so this is a diagram of fat distribution in someone who has estrogen dominance. And so the 2 on the left are the men, the 2 on the right are the women. And as you can see, men get fat in the breast area and in the midsection, just like women do. And so they have that abdominal obesity in the buttock area, and then also in the breast area. And this is what estrogen dominant looks like in a man. So phytoestrogens. Phytoestrogens are supplements that you can use that act like estrogens in the body. So they have the healthy effects. They're plant-based things that you can use to give the effects of estrogen. Flax seeds. And actually, if you have, so the thing about these is, let's say if you have heavy periods, if you have any condition where you're sensitive to estrogen, you actually should avoid these. But flax seeds, soybeans, tofu, carrots, cauliflower, broccoli, all these will help to alleviate some of the symptoms of low estrogen. Herbal things that you can use. These ESTROGEN, ESTROVERT, they have these in like Walmart and Walgreens. And if you look at the boxes, they'll say different memory loss or fatigue or things like that. But when you take these, they actually have these ingredients over here to the left in them for treating some of the specific symptoms that you experience due to low estrogen levels. And then again, you may end up needing to actually get hormone replacement. I personally do not prescribe synthetic hormones. I only prescribe bioidentical hormones. And so estradiol, as we talked about, estradiol it's actually from a certain yam. So it's plant-based, and this is one thing I do want to stress. A lot of women are sometimes concerned about taking estrogen replacement. There are no studies that show that taking estradiol increases your risk of developing cancer, unless you have, a cancer gene mutation or something like that. But the WHI study that we all know about, that people got all up in arms about, That study was actually done using synthetic estrogen. It was not done using natural bioidentical estradiol. And so I personally never prescribe anything synthetic. I only prescribe natural hormones. And so, but some women will also use a little bit of the estrogens, and it's called biased. And so they try to balance out the estradiol and the estrone. So now moving on to cortisol. Cortisol is your stress hormone. It is very, very important because what cortisol does, it allows your body to respond to any stressors that are presented to it. So it helps your body to defend against attack. It helps you to stay up when you need to stay up. It helps you to get away when you need to get away. And so it's very important for, you know, that fight or flight response that we talk about. Some of the beneficial functions of cortisol: it keeps you awake and alert. It helps you, again, with your clear thinking, emotional regulation. So it keeps you from being all over the place with your emotions. It gives you the perception of control. So what cortisol does is it helps you to feel like your well-being, your self-well-being. So a lot of times when you have a lot of anxiety, that's because your cortisol levels are out of whack. It helps in learning and understanding, with memory. It does actually help with balancing your water and reducing inflammation in the body. Balancing your blood sugar. Sometimes people with out of whack cortisol will notice that they have, especially if you have diabetes, difficulty maintaining blood sugar levels. And so this is what a 24-hour cortisol spike looks like. So in the morning when you wake up at 6 a.m., your cortisol levels typically low, and it should start to go up, so that mid-morning around 10 a.m. you should peak. And then over the course of the day, the cortisol should start to go down, so that by the time you go to bed at night, 10 p.m., it should be low again, because your body needs to shut down. You don't need to be running from a bear at 2 a.m. So that cortisol needs to be low. And then as the night progresses and you're moving back to the morning and needing to get up, it starts to go up again. So this is what a normal cortisol looks like. Now, when that cortisol gets imbalanced, we start to, again, and it looks just like imbalanced testosterone: gaining weight in your midsection, feeling run down and fatigued, not being able to sleep, elevated blood pressure, mood swings, sex hormone imbalance. You overreact to minor things because, again, you don't have that sense of well-being. For infertility problems, irregular periods, it's the same picture as imbalance in your testosterone. And so things that increase your cortisol levels: stress, 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 stress. I cannot stress that enough. When you live a stressful lifestyle, your cortisol levels are typically through the roof. You will experience more depression and anxiety. You have difficulties falling asleep, staying asleep. One of the things that a lot of times people will get into exercising. Exercise is a stressor on the body. So even exercising too much can increase your cortisol levels. Nutrient deficiencies. And so if you're on these extreme diets where you are at an extreme calorie deficit, that's a stress on the body, and that's going to increase your cortisol levels. Some different endocrine diseases, taking birth control, and then alcohol abuse. Or joining something like Revivery and going on a 24-hour fast can be kind of stressful. Get your cortisol levels all up. So how do you assess your cortisol level? You can use blood, urine, or saliva. I personally, well, until recently, I prefer to use saliva, and I'll show you why in a minute. When you use your blood, you're actually only getting a picture of what your cortisol level is at that moment when your blood is taken. When you use your urine, you get a 24-hour look at how much of metabolites, so how much cortisol did you produce and what metabolites. When you use your saliva, you actually take samples, 6 samples over the course of 24 hours. So you actually get to see what your cortisol is doing through the course of the day, so you can correlate it to that chart that I just showed you. There's actually now a test that I'm moving into using that does the same thing using urine samples, and it looks at the cortisol level and actually correlates it with the metabolites, so it's a little bit more sensitive. So I'm going to start incorporating that one, but I really do like to be able to see your cortisol throughout the day as opposed to just one spot, because you want to know when to support a person if you're going to help with the cortisol. So if you look at this chart again, the yellow is our normal. So this red here is an abnormal. And if you look at this person at around 1 a.m. when they should be asleep, so the cortisol should be at 2, you know, at a level of 2 because they're sleeping, they're not running or anything like that. Their cortisol level is through the roof. So this person's not getting good sleep. They're either, you know, laying in bed, tossing and turning, or they're not getting good REM sleep, but they're definitely not getting reparative sleep where their body's really getting any restoration. And so by looking at this, you know that, okay, we need to support this person during the night. And I also may need to give them a boost in the morning, but being able to see what's going on over the course of 24 hours is a lot more beneficial than just getting a 1-point check of cortisol. Foods you can take. Eat real food. Avoid processed foods at all costs. They are never, ever good for you. Adopt an anti-inflammatory diet. Caffeine, because it drains your adrenals sometimes, so you need to decrease the caffeine intake. Eat probiotic foods. Adaptogens, this is something we talk about in Revivery, using cordyceps for energy, reishi mushrooms, ashwagandha. It's going to help with your testosterone and cortisol production. And sleep. As we said, you want to really try to go for 90-minute sleep cycles, because a complete sleep cycle from getting all the way through a REM cycle is about 90 minutes. And so if you can plan it where you're getting a good 6 to 9 hours of sleep a night in 90-minute increments, you're going to really get a good restorative sleep. Really good sleep hygiene. So making sure, you know, it's a cool room. You've got all the electronics turned off. You should do only 2 things should be done in bed: sleeping and having sex. Don't eat in bed. Don't watch TV in bed. There's only 2 things you do in bed. And then waking up at the same time every day is really, really important for helping your body to set your biological clock. And so a lot of times people try to wonder what's best, going to bed at the same time or waking up. It's actually, studies have shown you really do better when you wake up at the same time every day. Stress management, as we said earlier, meditation and prayer works, counseling services, just getting out in nature. And again, and most people know, just having a pet, a dog seems to be a cure-all for everyone. I don't think I've ever met anyone who's had a dog that's not a happy person. And then moving on to thyroid hormone. Thyroid is probably one of the most misunderstood and poorly managed endocrine diseases that we as physicians manage. And hopefully after this, you will know more than your doctor, and you can make sure that your doctor's not mismanaging you. So symptoms of hypothyroid, and as you'll see, the symptoms are the same for everything. You've got weight gain, you've got hair loss, constipation, painful prolonged periods, you've got depression, anxiety, irritability, your blood pressure's going up. Sometimes you're feeling coldness and chills. The 2 most common things that people complain of is decreased energy and weight gain. Those are the 2 most common things people complain of when they have hypothyroid. So this looks very, very busy, but trust me, you'll understand it before we're done. So the way the thyroid works, if you look at this picture on the left, your brain makes a hormone called thyroid stimulating hormone. That's the TSH. The TSH tells your thyroid gland to actually make thyroid hormone T4. T4 is not active. It is inactive. It leaves the thyroid gland, goes to the body, and then it has to be activated to T3, which is the active form that the body actually utilizes. So if we put a line right here, only 20% of thyroid deficiency is a problem with the thyroid gland making T4. Most people have a problem converting T4 to T3, or the cell receptors are not sensitive enough and can't take in the T3, or the T3 is not binding. So when we look at, so when you go to your doctor, we only look at two things to diagnose you for thyroid deficiency. We look at your TSH and we look at your T4. And because most people don't have a problem with the T4, we'll tell you you're fine, yet you're like, well, but I have all these symptoms. And the problem with that is the body only uses T3. The body cannot use T4. The brain uses T4. So you're walking around with T3 insufficiency undiagnosed because we never even look at it, because we're like, your thyroid's making enough T4, you're just fine. But no, trust me, 80% of people with thyroid insufficiency, it's a problem below the thyroid gland itself. The other problem is when we treat people in traditional medicine, we give you Synthroid. And I'm sure everyone on here knows someone who's on Synthroid. Synthroid is 100% T4. It has no T3 in it whatsoever. So we're not even giving patients what they need for the problem. So what can you do? There are foods that you absolutely should avoid if you have thyroid deficiency. Goitrogens are foods that actually, so you need iodine to make thyroid hormone. So goitrogens actually decrease your body's ability to absorb the iodine. So unfortunately, cruciferous vegetables, we tell you they're healthy, but kale, cabbage, broccoli, Brussels sprouts, greens. For a long time when I was competing, I used to eat I used to eat all my vegetables raw just because it was easy to do that. But apparently eating my asparagus raw actually wreaked havoc on my thyroid gland. I found that out the hard way. Strawberries, peaches, pears, they also secrete a hormone that decrease your body's ability to absorb the iodine. Soy, the same thing. Any processed and fatty foods, again, because you're putting a big stress on your body. And we all know sugar and caffeine because of the stress that they put on your glands. Superfoods that you can actually take to help if you have thyroid insufficiency. So these are going to help you to increase your iodine levels. And so you need iodine and selenium to make thyroid hormone. So these foods will actually help you to increase your iodine and selenium. So baked fish that is rich in omega-3, salmon, cod, bass, haddock, some nuts, Brazil nuts, macadamians, hazelnuts, roasted seaweed, organic dairies. So even though usually we tell you not to eat cheese, if you're eating some of the organic yogurts and cheeses are actually pretty good for increasing the vitamin D, as well as I think that selenium is in those, and organic beef as well. And then finally, you can use some of these supplementations will help that you can get. This Pure Encapsulations is a brand that I love their products. They're really, really good products, but some people who have thyroid insufficiency will take iodine supplements. I've not done a whole lot of research on that, so I really can't say if it's beneficial to take it if you don't have thyroid insufficiency, but I do like this brand. But these supplements will help you to, if you do have thyroid insufficiency, to help your body to make your own thyroid hormone. So if you are getting your thyroid glands, your thyroid hormones checked, write this down. Your doctor should be looking at all of these. He should look at a thyroid stimulating hormone, a T4 free and total, a T3 free and total, Actually, it doesn't really matter if they look at the total, but definitely the free. So TSH, T4, T3. Now, the two on the right here, the reverse T3 and the thyroid antibodies, if you are someone who has been on treatment and you're still having issues and we need to do a higher level panel, that's when we need to add these, because now we're looking to see if you're making antibodies that are attacking your thyroid gland, or if you have signs of inflammation. That this reverse T3 is a form of T3 that when you have inflammation, it alters the T3 so that it's permanently inactive. So you've got this T3 circulating around that the body can't use. And that's usually something that happens in someone who has really bad systemic inflammation. And so when we have patients who have really bad disease, they're not responding to the medication, we add these other two. But your beginning panel should have a TSH, T4, T3. And then if you have, you're not responding, you want to add on these other two. And so just remember, every single thing you do is dependent on the performance of your thyroid hormone. 99% of the cells in your body require thyroid hormone to have enough energy to maintain their function. And so even with small deficiencies in your thyroid hormone levels, you will feel it. You will literally feel like you've crashed and burned. And so it's so important that your thyroid hormone is maintained, just because it is so essential for every process in your body. So my final words are you looking to be normal, or do you want to be optimal? And then I put this on the end because this is kind of what catapulted my own journey into bioidentical hormones. Let me see how much time I have left here. But when I was 40-ish, I think I was 40-ish, I was competing, and my workout partner was 26 years old. And we worked out together, and she literally, I could lift twice what she could lift. I was strict on my diet. She would eat whatever she wanted to eat. And she would look at weights, I mean, literally, and she would just put muscle on. I couldn't put muscle on to save my life. And it's like, I'm like, what the heck is going on? And, you know, through just circumstances of life, I met this nurse practitioner who introduced me to bioidentical hormones. Well, we tested my hormones, and I had no testosterone. I had no growth hormone. My estrogen level was high. I mean, it was crazy. The lowest the machine will measure on testosterone is 7. Mine was less than 7. And so my thyroid wasn't working, nothing. And so we corrected my hormones, and literally within a month, my body started responding. And that's me on stage at 46. And so, and I tell you, just maintaining my hormones it's been life-changing. And I will never go without my hormones. That's all I can say. But yeah, so that's that. Does anyone have any questions?
Yes, thank you so much, Dr. Bogard. Let me unmute everybody, and you have to unmute yourselves too. So please speak up with questions. Thank you.
I have a lot of questions.
Shoot.
I don't know the protocol. I missed the first meeting.
That's
But
okay.
anyway, that was fascinating. Thank you very much.
Oh, you're welcome.
I'm a 62-year-old who had a complete hysterectomy at 45 years of age, have also been diagnosed with Hashimoto's. So I'm hearing all this saying, you know, I get fatigued, I have weight gain, I don't make muscle, but I just get, you know, once a year thyroid draw at my doctor. So I don't know where I can learn more about this and have this looked at more. And I do take estradiol. Sorry about all the personal information, but since we're talking about it. So yeah.
I always tell people, like, whenever you step into the world of gynecology, because essentially that's what I am, you're going to hear, just be prepared to hear anything.
Yeah. So knowing all that, knowing that I don't have a physician that has ever said to me, Karen, we should do all these tests. Where do I do in Tucson, Arizona to pursue that?
So you would want to look for someone who specializes in anti-aging medicine.
Okay.
I can let me do some research and I'll let Josh know if there's someone in Tucson that I can refer you to. Otherwise, I will let Josh know how I can help facilitate you getting, because we can do some telemedicine things.
Okay.
But we can, but let me see if there's someone there in your area and I can give Josh that information.
All right. That's awesome. Thank you.
Karen.
You're
What
welcome.
that's great. Thank you. Thank you. Looks like we have a few more questions. Go ahead, Holly.
Well, I'd love to get your take on my situation. Really, my health journey started turning around about 4 years ago, and I've lost 113 pounds.
Oh, wow. Congratulations.
Thank you.
Congrats.
And it's been really great. I still have more to go, and everything kind of leveled off. And I've worked with the nutritional end of things. I've worked with the stress end. I'm following some of the protocols from the book Liver Rescue, to help detox. So I've been doing things like that. I work with some really great holistic people in my area, but I've wondered if the hormonal stuff is the missing piece of why everything levels off and I'll lose like a pound and then it just kind of sits there and,
It can, because it's like I said, for me personally, and I can tell you, I've had lots of patients where they've said the same thing. It's like, I can't, this last 10, I just can't. And we fix their hormones and all of a sudden it just becomes easy again. It's like you're giving your body, you're giving your body the building blocks that it needs to do what it naturally wants to do. And so it definitely, the two that are really important are the testosterone and the thyroid hormone. If they are low, it is very difficult to lose weight.
Okay. Thank you. Like, it gives me a place to start as far as getting more information. Thank you.
Great. What other questions do we have? I can't see everybody, so just speak up.
Dr. Shyrlena, question for
Yes.
you. When should people start caring about hormone levels? I mean, I'm not older and more mature, and so it's like, when should it be a good time to start caring about these things?
Well, definitely if you're feeling anything. So, because I have women in their 20s who have abnormal periods, because of the lifestyle that we tend to live, where we have high stress lifestyles with jobs and the environmental exposures that a lot of us have. I'll have younger women or men, because I have male patients as well, who begin to experience some things and come in. So if you're experiencing anything that, it's like, no, I'm not depressed and my doctor wants to put me on an antidepressant medication, then it's worth getting a look at your hormones. But otherwise, I would say for women, maybe it's around age between 35 and 40 is when you'll start to have that, the change in the balance of hormones. And you really want, at that point, usually it's the progesterone. We didn't talk about it, but it's the progesterone that needs to be supported because it drops so quickly compared to the estrogen. But if there's anything that you're feeling, it just is off, before going on a bunch of medications, I would have my hormones checked. Just because of all of our environmental exposures, there's no way around it. Living here, we just get so many exposures, and there's nothing we can do about it.
All right, thank you. What other questions?
Do you have any recommendations for getting around like some of the doctors and the insurance providers, in the sense of, so like testosterone gets tested, you're in that normal range, but it's a low normal. And so therefore a lot of insurance companies, right, aren't going to support or allow you to get HRT and have it covered.
So the thing is to go to the right doctor first. So do not go to a doctor who uses the term normal. So for a man, most men function best when their testosterone is between 8 and 1200. So if your doctor is telling you it's normal at 200, run away from him, because yeah. But so usually for men, if the doctor puts on your chart the code testosterone, if he puts there anything about libido, that you have orgasmic dysfunction, erectile dysfunction, or testosterone insufficiency, most insurances will cover testosterone supplementation for men. So the doctor just needs to put that on the chart, and you typically don't have to give the insurance what the actual levels are. So if you can find a physician who will, open his thinking and know that you need it to be more than 200, that's one way to do it. The other thing is, most of the time, if you go to some of the BHRT clinics, your labs, they typically will accept your insurance for the labs. But, and then the medications are 50-50 whether they accept insurance for those. So that's another way to get it done. And it is, sometimes, because a lot of them don't deal with insurance at all, it becomes a little bit difficult. But most of the time, if you can find a physician who'll just put the words on the chart, insurance will cover it.
Thank you.
Cool. Any other?
What type of lab was that?
So BHRT, the bioidentical hormone replacement clinics.
Okay, because I have a hard time, like in just network medicine. I see my doctor once a year for a physical. They don't do anything more than basic blood panel. I've asked for extended stuff, but even then it's kind of daunting because I'm still in network, in that network.
Mm-hmm.
And the follow-up to actually start a regimen of hormone replacement just seems, it's very frustrating. So would our labs a better choice? Or you were talking a little bit about telemedicine. How does that work?
So a lot of the physicians, especially now with COVID, a lot of physicians are now offering telemedicine services. And so you can typically, I would do again, I can let Josh know too, but you can do a search for hormone replacement therapy in your area. And if there's someone there, most of them, and because you're in California, so I know in California there are a lot of options. It's like hormone mecca. It is, because everyone wants to live forever. But it's a lot, you can find someone, and they have a lot of the ones in California, they have the clinics that you can go to, and they have a set price where you come in, and it includes the labs and the consultation and your medications all in one. That would probably be the easiest way, utilizing one of the clinics that they have.
I appreciate it.